Is your child feeling weak, tired, or is he getting frequent infections? The truth is, frequently it is associated with weak immunity, growth development, and even brain development.
That I was shocked to have treated a child with pure iron deficiency anemia whose hemoglobin had fallen to 3.6. Globally, it is said to be somewhere between 1 in 3 to 1 in 5 children. So that's a pretty high incidence of iron deficiency.
Right.
The mother was so distraught because the child had temper tantrums.
Okay.
We started a therapeutic trial of iron and the tantrums just disappeared. Now coming back to the effect of milk, because it definitely does not let our body absorb the iron.
What is the biggest mistake you have seen parents do as far as this iron deficiency anemia, either diagnosis or treatment is concerned? Namaste everyone, welcome to one more episode of podcast with me. I am Dr. Amitabh Kulkarni. This is a space where we discuss about health in a simple, honest and practical manner. We talk in a jargonless language. The purpose of this podcast is to help you understand better about your body, about your health, so that you can take smarter decisions about your health. In these podcasts, we identify a common topic, try to identify an experienced healthcare person, and try to understand the topic from the experts in that field. Now, today's topic is something very common in children, interesting as well. Is your child feeling weak, tired, or is he getting frequent infections? Many a times parents hear this term called as iron deficiency or iron deficiency anemia. But frequently it is disregarded as something minor or just the low blood. Is it the fact? The truth is, frequently it is associated with weak immunity, growth development, and even brain development. To help us understand this topic, I am joined by Dr. Kalpana, who is an experienced and leading consultant pediatrician who has treated thousands of such cases. She is going to tell us what causes iron deficiency, what are the warning signs. She is going to also clear the myths and how do we treat this iron deficiency in children. Dr. Kalpana, welcome back to our channel. I know most of us know about you now, but for all our new viewers, can you just tell us something about your background?
Thank you, Dr. Amitabh, for inviting me again. I am Dr. Kalpana Sengupta. I am a consultant pediatrician and have been practicing in UAE since 2003, prior to which I was an associate professor at a leading children's hospital in Mumbai.
So let's get started. Dr. Kalpana, in fact this topic is suggested by you.
Yes.
So what made you suggest this topic?
You know, Dr. Amitabh, it is not uncommon to see iron deficiency or iron deficiency leading to anemia in children. What prompted me to suggest this topic to you is that I was shocked to have treated a child with pure iron deficiency anemia whose hemoglobin had fallen to 3.6. So that, is a very low level.
How common do you see such low hemoglobin?
It is rare. And generally not due to pure iron deficiency. We do see it in other causes of anemia.
True.
However, this got me thinking that we need to address this topic so that parents take note of it and take timely measures and don't let it fall to such a low level.
Thank you. Very good suggestion. Thank you for the suggestion. So what is iron deficiency anemia in children? What exactly is this?
So we have to understand that iron is a mineral. Now this mineral is important to form hemoglobin. What is hemoglobin? Hemoglobin is a protein which is in our red blood cells and it carries the oxygen that we inhale to the various parts of our body for effective functioning of our body. So when iron is less in our body, it will lead to a lower hemoglobin. So there will be a lesser oxygen carrying capacity of the body and it will lead to all the ill effects that we see due to iron deficiency.
How common is this problem in your day-to-day practice?
So it is pretty common. Earlier, when I was practicing in India, in a low resource setting, it was much more common. What really nowadays I feel is that even though we have advanced in so many ways, we are sitting in UAE with all the resources at our disposal, yet we are seeing a significant number of children with iron deficiency. Globally, it is said to be somewhere between 1 in 3 to 1 in 5 children. So that's a pretty high incidence of iron deficiency.
Right. So then how do parents identify this? What are the early signs of iron deficiency in children?
Early signs generally which get missed by parents, in fact, are irritability, behavioral disorders. So these get missed. They attribute it to variety of other causes.
True.
And they don't think of nutritional deficiency.
Correct.
What they do pick up is, a child feeling lethargic, child feeling tired, or child looking pale. So because of these reasons, they may come to us. But the cognitive effect, by that I mean whatever effects it has on our brain. That generally can get missed.
You told about tiredness and all, weakness, tiredness. So is it always seen with iron deficiency?
No. Now here I would like to make a distinction between iron deficiency and iron deficiency leading to iron deficiency anemia. So one fact to remember is that our body, nature has made it in such a way that every last resource of the body is used to maintain effective functioning.
Correct.
So we may be suffering from iron deficiency, but utilizing all the stores of iron in our body and not letting the hemoglobin fall. It is only when the hemoglobin falls below a certain level that we start seeing the ill effects like tiredness.
So even if someone has a low iron, it may take a lot more duration before he actually develops anemia.
Absolutely.
In the body.
It will take time before he develops anemia. And on the other hand, if you don't pick up iron deficiency and you just do certain tests just to pick up whether there is anemia or not, you will miss the iron deficiency. That is also important.
Yeah. Thank you very much. So then this anemia, can it affect child's behavior or development overall?
Definitely. It affects the child's growth, development, behavior, immunity. It affects the cognitive functions. I had a child brought to me, just the mother was so distraught because the child had temper tantrums. And she didn't know how to handle it. And
that is so common nowadays.
Yes, very, very common. However, she tried her level best, but when on examination we found iron deficiency anemia, and to be very truthful, it's not that I thought that would just solve the problem, but it did the trick. We started a therapeutic trial of iron and the tantrums just disappeared. This is not to say that all tantrums are because of iron deficiency, but we have to look at the physical causes as well.
So this is a very important point for viewers to understand, that any unusual symptoms in your child, if you notice, better to get it checked with the expert, so that you may find some deficiency of something like iron or any other thing which will quickly fix the problem. Are like toddlers or infants also at the risk of development of this particular iron deficiency anemia?
Yes, infants and toddlers are most at risk. Yes, because we have to understand that a baby, when baby is born, has accumulated stores from the mother.
Correct.
So, if we don't do the weaning properly, if we don't do the supplementation properly, especially in exclusively breastfed children, we see anemia developing. Then again, it also depends on whether the baby was a full-term baby or a preterm baby, whether the baby was of an adequate birth weight or a low birth weight baby. Because preterms and low birth weight babies, their stores are less. So we have to give them the supplements in sufficient quantities and for sufficient duration, so that we avoid this. And also, this is a rapidly growing baby.
Correct.
So the demands,
the requirements are more.
Yes.
So you told about exclusive breastfed. So there was a discussion that whether the milk causes iron deficiency. So is it a fact? How true is the statement that milk can cause iron deficiency?
Right. So 2-3 things to understand here. One, exclusive breastfeeding is recommended till 6 months of age. But
Okay.
it has been noticed that the breast milk iron content is low, but the amount available is more, what we call bioavailability, it is more. However, having said that, we have to monitor breastfed, exclusively breastfed children after the age of 4 to 6 months. And if they develop iron deficiency, that has to be treated. Now,
Is it anything to, sorry to disturb, is it anything to do with anemia in mother per se? As such?
yes, absolutely, because the baby that is born is now, first thing is how is the mother,
Correct,
how is the, parent. So that is very, very important. However, baby is a parasite. So baby will take everything
Whatever
from the
is
mother.
required.
Yes.
Yes.
Now, coming back to the effect of milk, I need to stress this because when we see children who are being given whole cow's milk, or who are being given milk for in quantities in excess of say about 24 ounces per day, those children we see iron deficiency very commonly because it definitely does not let our body absorb the iron.
Okay,
So yeah,
okay.
so that is a recommendation we give to most of the parents here who come with iron deficiency with infants and toddlers. We look at their diet chart and we realize they are taking too much of milk.
Yeah. This is very, very interesting because we were under impression that milk is supposed to be
Good for the
the
babies.
complete nutrition for babies. Yeah, thank you very much for clearing. Now then, which are the foods which are like the best for the store or development of iron sources in the body?
So iron sources in food can be divided into plant-based and the animal sources. So we say the plant-based sources are all green vegetables, green leafy vegetables, green non-leafy vegetables. Then you have dates, you have figs, you have legumes, you have nuts. These are the good sources in vegetarian diet.
Correct.
And non-vegetarian, the red meat, the organ meats, seafood, these are good sources.
So it is equally, I would say, equally distributed in vegetable as well as like non-vegetarian food. So do you see any disparity otherwise when you see iron deficiency, whether it is more in vegetarian against non-vegetarians or otherwise?
It is equally distributed in nature. However, if somebody is a vegetarian and is not taking the things that I have just mentioned, we tend to see more deficiency. As you know, nowadays children, those who are especially non-vegetarian, they are very fond of their non-vegetarian food. So they consume larger quantities and their hemoglobin is well maintained.
Well maintained, yeah. So in someone who is vegetarian, I would say, are plant-based like foods, are those enough to maintain the iron stores then?
Yes, they are enough. On the whole, they are enough. If you are managing the, if you are giving a balanced nutrition to your child.
Correct.
But during periods of, increased requirements like rapid growth spurt periods, or in adolescence, or in adolescent girls once they start menstruating, the requirements increase.
Correct.
Intercurrent infections, any bleeding, those are the cases, or surgeries. Those are the stressful times when our body may need extra support and we may need to give supplements.
Supplements, yeah. So how do we check this? Like how do we know whether someone has anemia or specifically iron deficiency anemia, and when should we get it checked in children?
Okay. So when we should get it checked, we have clear guidelines from American Academy of Pediatricians. First check is between 9 to 12 months of age.
Okay.
The second used to be like 15 to 18. Now they have said at least by the first birthday, one check has to be done.
One check of hemoglobin with iron?
Yes, two things that we need to check is hemoglobin. We generally would do a complete blood count because that gives us much more information.
Right.
The second most important test to do is the stores in the body, and that is reflected in a test called as ferritin.
Ferritin.
So the hemoglobin and ferritin are the two most important basic tests.
So you mean to say by the age of 1 year, irrespective of symptoms, we should get checked, or only
Yes,
if there are
irrespective of symptoms, it's a screening test. It's a screening test.
Thank you very much. Even I understood this today. Frequently for supplements we give these tablets, syrups for children. So how safe are those tablets or syrup if they are consumed over like say long prolonged duration in children?
We have to remember this is a medicine. So medicine has to be used in a proper way.
True.
They are safe, but they have to be kept away from the children. Why I'm saying this is because nowadays a lot of gummy preparations have come in.
Correct.
Children use them as candies. And if the parent is not careful, we've had cases wherein they've gone, opened the cupboard and gulped down the entire bottle. So any medicine has to be treated as medicine.
Accidental overdose can happen.
Yes.
Accidental. So then what are the common side effects which children and parents should be aware about when they are consuming this iron supplements, whether it is a tablet or syrup or any other form?
One of the commonest side effect is constipation. The other being teeth staining. These are the two things parents come to us with. Constipation was more common with the earlier preparations, the older preparations that were there in the market. With the newer preparations and newer methodology developing, that problem has become much less. As has the teeth staining as well.
Is there any difference between like tablet, capsule versus syrup for these side effects?
Not really. It's not
it's
like dependent
equally
on
seen in all these preparations.
It's equally seen. Mostly for children we are using syrups, except for adolescents where we would go for tablets or capsules. I don't see a difference in the side effects per se like that. It depends on the salt of iron being used.
Okay. Thank you very much. Now once the medicine is started, how long does the treatment duration is there?
So this is the most important point to remember, because the duration is anywhere between 4 to 6 months. Now why this long? Parents always ask us. We need to monitor these children not only to see that their hemoglobin is normal, but to also see that their body stores have been replenished. Because if we have not done that, all we are going to do is, if we don't take adequate measures, dietary measures, after another 6 months, the child will come back to us with anemia.
Correct. So, on an average 6 to 7 months with a periodic monitoring of say hemoglobin, iron levels, and iron, most important is iron stores. Okay, got it. Now we have seen sometimes in children it keeps on happening again and again in spite of complete treatment, full treatment. So what is the reason for that?
So in our practice, even though parents will say full and complete treatment, the commonest cause is non-compliance. So as we said, it's a 4 to 6 months of treatment, and it is someone has to take responsibility to administer it to the child daily. Child has to cooperate. So if it is not followed to the T, we see recurrent things happening. Of course, like I mentioned earlier, the stressful situations, if any of those happen, or when the body demands of iron are more, in those cases we may see this happening again. Having said that, there are causes which we have to look for. If iron deficiency is happening again and again, we have to evaluate the child to see whether he's not absorbing the iron or whether he's losing the iron somewhere. So we have to investigate him for more sinister causes of iron deficiency.
Thank you very much. So here I think the role of parents is very important. They have to make sure that child is taking the medicines as per the recommendations, and he should finish off the course as advised by the experts. Now since we are discussing this topic, just want to know whether it can be prevented completely, iron deficiency, so that if we take proactive actions well ahead of time, is it possible to prevent this anemia altogether?
Definitely it is possible. So that is why I say in the first year of life, a monthly checkup of the baby is recommended, so that all these issues can be taken care of. The pediatrician can guide the parents as to the variety of dietary measures, especially the age span of 6 months to 12 months is very important. If that time you have handled well, you will have a peaceful toddler years.
Understood. So prevention is better than cure. So always periodically check for the signs, symptoms, and this. Now coming to the side effects again, which is actually probably being discussed always in clinic as well. The two common side effects, one of that you already mentioned, one was teeth staining, and second is probably weight gain. So is it very common with all these supplements in your practice?
No, so how to understand this, just we have to remember that if a child is not eating well, he becomes iron deficient.
Correct.
Iron deficiency in turn leads to loss of
Weight loss,
appetite,
yeah.
and hence, we see this as a vicious circle.
Yeah.
So now what is happening? You have provided the iron, his appetite increases, and he starts gaining weight.
Yeah, yeah.
So if that weight gain is within the normal for the
Correct,
age of the
correct.
child, it's not a problem. It is in fact welcome and a healthy change.
Yeah, so it is in fact the weight which he had lost and has regained again. So
Lost or not gained.
yeah,
That he is coming back to the normal values for his age.
Correct,
That is always welcome. As far as teeth staining goes, it's a common problem. Again, it depends.
especially in teenagers and all, probably they are more worried cosmetically.
So this generally happens in younger children where we are using syrups.
Correct.
Teeth staining happens in them.
Okay,
it doesn't
okay.
happen with tablets and,
all.
capsules.
Yeah.
So we always instruct the parents to give the medicine a little deep inside the cheek and always to gargle or clean the teeth after that. However, rest assured, it's a temporary staining, and you can very well go to any good dentist
and get it
they
cleaned,
can
yeah.
very easily take care of this.
So even if it happens, it's a temporary issue. Teeth staining, the weight gain, as Dr. Kalpana has clearly mentioned, it is probably a healthy weight gain which he had lost because of iron deficiency and loss of appetite. Coming to the next question, can this anemia be a sign of something more dangerous disease inside which he is carrying in the body?
Yes, it can be. And in this, even something as simple as a worm infestation, which we used to see very commonly in India, we don't see it commonly in UAE.
Correct.
That is one of the causes. But like I said, that if the iron supplements are being given in adequate quantities, yet we don't see the rise, then we start thinking that maybe the body is not absorbing the iron.
Right,
so these are conditions called as malabsorption, and we have to look for them and we have to treat them appropriately.
Yes.
The second major cause would be loss. That is, without you realizing, if there is some blood loss from the gastrointestinal tract, that will not allow the iron to rise or the hemoglobin to rise. So we have to look for those causes. We have to go to the root cause and treat that.
Yeah. So either it is not absorbed or it is getting lost even if you are consuming. So definitely it needs an expert and detailed evaluation to find out if there is any other disease apart from just a simple iron deficiency.
To clarify, this is for iron deficiency anemia that we are talking about. Anemia per se is a huge topic, and that has variety of causes. With a lot more sinister things that is beyond the scope of today's
So maybe
discussion.
he may be having some different type of anemia in addition to iron deficiency. Yeah. Now frequently it is said that someone who has iron deficiency, the children we are talking about, he should not be allowed too much of physical activity. So is it a fact? What is your suggestion?
No. So as a pediatrician, the aim of treating a child is that he can do age appropriate activities.
Correct.
Now, in all the mildly anemic children, we never restrict physical activity.
Okay.
But yeah, if someone's hemoglobin is very low, he is showing signs of his heart failing, we will restrict his activities till we get the hemoglobin up to a safe level. So it depends on the severity of the case.
Correct. So it depends on the hemoglobin level.
Yes.
Yeah, and he's still allowed age appropriate activities. So we should not be restricting activities without consulting, of course, the treating doctor. Yeah. So frequently it is said that iron deficiency or anemia can weaken your immunity, and children are susceptible to frequent infection because of this anemia. So what is your take on that?
It is absolutely true, because all these micronutrients have a very, very big role to play in the development of immune system in children. Also, how often they contract illnesses and how their body responds to the treatment. This is very commonly seen in clinical practice, and hence when parents keep asking us that give us something to build the immunity of my child because he falls ill. First thing we look at is these iron deficiency and the other micronutrient deficiencies, because nutrition has a direct role to play in development of immunity.
So viewers, please understand, iron deficiency directly can weaken your immunity, and the child can get frequent infections. So someone who is having such symptoms again and again or frequent infection, better to check iron deficiency and get it corrected, because it is easily treatable. So Dr. Kalpana, this is the last question. In your practice, what is the biggest mistake you have seen parents do as far as this iron deficiency anemia, either diagnosis or treatment is concerned?
Yeah, so two major things here. One, we have already touched upon, that is the non-compliance. They understand everything, they are educated parents, and they start off, giving the medicine very regularly. They may do it for 2-3 weeks, and then they just lose momentum and give up on it.
Correct.
So that is something that we have seen commonly, or not coming regularly for the checks so that we can monitor whether the child is responding adequately to it or not.
Correct.
But remember this in terms of the medicine that we are giving. The biggest responsibility of the parents is to see that this does not happen again. Correct. How do they prevent it? So they have to follow the diet. They have to change the habits of the child, and that is where they have to put in efforts. Correct. And as you know, Dr. Amitabh, here most of the parents are working parents, and the children are being taken care of by nannies or a family member. So there are practical difficulties, but it is our responsibility as pediatricians to motivate this family to take care of such a simple thing. So always prevention is better than cure. The earlier you start putting good habits for your child, it will serve you throughout the life.
Correct. So these are all simple things which are preventable.
Absolutely.
Taking medicine on time, proper diet, doing checkup on time. These are the common mistakes which can be easily rectified. Thank you very much, Dr. Kalpana. This is the end of first part of our podcast. Now let's get on to the second part, which is rapid fire, wherein we ask simple questions which we want one letter or probably one word answer, or yes or no type of answer. Sure. So what is the most common cause of anemia in children?
Iron deficiency.
Iron deficiency, yeah. Which is the best iron rich food for kids?
So greens and meats.
Greens and meats.
Meats.
Okay.
Because both the sources are important.
Correct. What is the one symptoms parents ignore most?
Irritability.
Irritability, yeah. Maybe they just blame it to the tantrum, personality, and all other things. Milk, friend or enemy?
Enemy in today's discussion.
Okay. Best time to give iron syrup?
Best time is pre-meals.
Pre-meals, doesn't matter morning, afternoon?
Not really, because a meal interferes with the absorption. So when we start the iron treatment, actually we start it in the body to get used to it. We start giving it after meals, but then we change it to pre-meals. Okay. Vitamin that improves iron absorption? Vitamin C. Vitamin C. So should it always be given with? It should preferably be given. Okay. Either as a dietary source or as a supplement. So are these preparations with vitamin C by any chance? No. No. Here, we have very strict guidelines, but separate preparations are available. Yeah. What is the most common side effect of these supplements? Constipation. One age group at highest risk? Two age groups actually, infants and toddlers, and then adolescents. Okay. What is the one test to confirm anemia? Hemoglobin. And what is the one word advice to parents? Balanced diet and mindful parenting. Thank you very much. This was very honest
crisp and to the point discussion. This brings us to the end of this very interesting and very informative discussion with Dr. Kalpana. Viewers, please understand iron deficiency anemia is easily treatable with tablets, capsules or syrup. However, if you ignore it, definitely it can have its negative effect on child's growth, brain development as we discussed, and even they are at a higher risk for development of infection. So, Dr. Kalpana has clearly told us what are the signs and symptoms, what are the reasons, and how do we easily treat this anemia, of course with experts' opinion. If you have any questions related to today's discussion, please write it down in the comments. We will be very happy to answer those questions. If you want any specific topic from Dr. Kalpana in future in pediatrics, we'll definitely welcome the suggestions. We'll check with her availability and can plan it in future. The purpose of podcast, as we discussed earlier also, is to make you aware about your healthy options, make you aware about your body, and make smarter decisions related to your health. So this is me, Dr. Amitabh, with Dr. Kalpana signing off from today's episode. Do subscribe to the channel, do forward this discussion with say parent or the people with iron deficiency anemia, so that they will be benefited, as many people will be benefited with this discussion. Thank you very much. Thank you.
Thank you.